I was born when my mom was just 18 years old. She lacked the education and resources to parent in a healthy way. As a single mom in my 20s, I vowed to do better. Though I completed my master's degree and became an educator, still as my own kids got older, I didn't have all the information I needed to support them. I read books and sought help from professionals, and it was time-consuming and extremely expensive. I knew that while I was fortunate to have time and access, others didn't. Through conversations with my colleague Shauna McKenna, I saw this same desperation and passion for this work. Their health journeys are very different and yet the same. So we created Phronesis Health Initiative and the Health It's Personal podcast as a collaborative effort to bring education on a multitude of health-related topics for those who need it most.
We began this work in earnest in 2019 to help those facing challenges like ours. Unfortunately, things got harder during the pandemic for everyone, exacerbating health issues across the globe. As we've seen, it's a massive challenge to ensure that everyone has access to accurate information and health experts, and reaching across borders with information in a relatable and accessible way is what keeps us motivated to take on this challenge.
There has been a huge uptick in demand for treatment in anxiety and depression since the pandemic began. Many health professionals report waitlists that continue to grow, so they are working beyond capacity. Paired with folks' need to get education about all matters of health, that's where we come in to provide accurate, reliable information and connections to doctors, experts, and others going through those same challenges. We're also building a strong community to support our audience, connecting people through a variety of digital platforms.
The global mental health market was valued at over $380 billion in 2020 and is expected to grow to over $500 billion by 2030. While other businesses in this space are narrowing their focus, since we last applied to Venture Devils, we've actually expanded our reach. Initially, we planned to reach high schoolers, college students, and their caretakers, but we've discovered that any space you can imagine has room for health resources and support. We've expanded into corporate spaces to help with balance, collaborated with publishers to connect with important authors, worked with military veterans regarding mental health and service, as well as many other experts and activists in the environmental and conservation spaces.
We've found that no matter where individuals and companies are on their personal and professional health journeys, they're excited to use their voice on our platform because of our shared passion. Not only have we had the pleasure of interviewing New York Times and Washington Post journalists, renowned scientists, doctors, educators, and parents, we've forged relationships with companies and partners like the authors at HarperCollins, the conservationists at Force Blue, the team at My Octopus Teacher, and brands that align with our values and topics like non-alcoholic spirit brands and so much more.
We started Phronesis in late 2019 and began our podcast at the beginning of 2020 to build our audience and to form partnerships with other organizations and experts. We presented at Pitch Playoffs around this time, but since then we've grown tremendously. We first started collaborating with experts close to us as we began with our series on anxiety, later moving to other topics. We helped friends and colleagues with health-related concepts they're struggling with. Our guest list has since grown immensely, and with this new expertise, we've been able to leverage our own understanding of opportunities to grow.
Since we saw you last, we've added public speaking engagements, workshops, and partnerships. We've appeared as guests on podcasts to gain reach and listenership, and created the You Are Not Alone merchandise line to create connection and raise funds. We've also worked with student ambassadors at high schools and colleges around the country, and by the end of 2022, we hope to double our audience size, present at 5 new live events, and establish ourselves as social media educators on Pinterest, TikTok, and Reels, as that is where current trends are showing where audiences are moving.
Phronesis is a woman and queer-owned organization that values diverse voices and perspectives in all health-related conversations. Kate provides parenting and educator perspectives, McKenna guides us with her young adult and journalistic perspectives, and Sean helps the team view subjects through a queer lens. We also have an amazing team of interns who worked with us last year and will continue through the end of 2022. We want to give a huge shout out to the various mentors who helped us along the way, and we certainly couldn't do this without our amazing audience who wanted to share a few thoughts of their own.
Thanks to Help This Personnel, now I'm able to understand that I'm not alone.
HIP has really helped me understand the nuances of my own trauma and that of others. Thank you, HIP.
You've taught me how to grow as a person and be more accepting of myself.
Thanks for helping me prioritize mental health.
I am so proud to be a hipster.
Thanks for everything you do, HIP.
In order to make the biggest impact, our financial ask is $10,000. We plan to allocate $3,500 to technology, subscriptions, and content editing. However, in order to reach more people with this crucial information and to help them continue spreading this knowledge to their own communities, we have to first reach them. That's why we'd love to allocate $1,500 to marketing and advertising and $2,500 to facilitate more workshops and speaking engagements, as well as an additional $2,500 for web design and SEO to ensure our content is able to organically reach more people in impactful ways. Your financial support will will help us make a much needed difference.